Hello, everyone. My name is Dr. Hillary Geiser. I'm an optometrist and assistant professor of optometry at the New England College of Optometry, and I practice here in Boston at the Charles River Community Health Center. So today I'm going to be doing the first part in a series of 3 lectures on binocular vision testing. First, before I get started, I just want to say thank you to the Orbis team for the opportunity to present today and for all the support from Dr. Sarah Wozniak, Dr. Johnson, and Dr. Gayatri Srinivasan for their permission using the videos and their help in assisting me with this lecture today. So I said today is part 1 in a series of 3 lectures. Today I'll be covering introductions to tests used to assess the function of accommodation in virgins and analysis of normative data in the test results. Part 2 is going to be an introduction to common near binocular vision disorders, how to identify these disorders using common binocular vision testing, and I'll also be discussing cases and giving examples of common binocular vision disorders. In part 3 of my lectures, I'm going to be doing an introduction to common techniques to manage common binocular vision disorders. So today's lecture objectives, I'm going to teach you how to do an introductory battery of binocular vision testing procedures, and we're going to gain an introductory understanding of the theory of each binocular vision test. And at the end of this lecture, I want you to be able to confidently conduct a basic binocular vision exam. So I'm just going to ask the audience, how familiar are you as a provider with completing a basic binocular vision assessment? Do you perform these regularly? Have you learned them but you're not confident in applying them? Have you seen them but never actually learned them? Or do you have no knowledge of binocular vision tests? So I see that a large majority are fairly use basic binocular vision testing quite frequently, with some not so familiar. So that's great. I hope this lecture is very helpful for you today. So what is functional binocular vision? The whole goal of having a good functioning binocular vision system is to have clear, comfortable, single vision when using both of your eyes. This is determined by a balance between the patient's refraction, fovea position, virgin's ability, and accommodation. Any imbalances in these systems can negatively impact the patient's quality of life. There's an imbalance, maybe convergence insufficiency, say, patient might not be able to pursue higher education, might have trouble reading, things like that. So what are indications for binocular vision testing? So any abnormalities may be noted on binocular vision screening procedures during a standard comprehensive exam, for example, cover test or stereo vision. Maybe the patient is symptomatic for visual fatigue, headache, they're having symptoms such as fluctuating vision or difficulty focusing, maybe some intermittent double visions. All of these are indications for binocular vision testing. Binocular vision abnormalities are very common and can affect all ages. They're considered non-pathological. They're considered an anomaly in that they're non-sight threatening, but they can significantly impact patients' quality of life. I touched on this briefly just a few seconds ago, but quality of life concerns include school, work performance, hobbies, and general visual discomfort. So when I'm thinking about a core binocular vision exam, a very basic introductory binocular vision exam, what do we need to be looking at? So the very first step is to determine the need based on case history or possibly a previous diagnosis. We must always, always, always start out with an accurate and current max full plus refraction with binocular balance. We don't want to do a binocular vision exam on someone that simply might need a pair of glasses and might be symptomatic because they need a pair of glasses. We should always measure the magnitude and direction of any phorias, rule out any tropias at distance and near, and look at the ACA ratio, which I'll cover in more depth later. We should also assess the positive and negative fusional vergence using both direct, and we can also use indirect methods. I'm just going to be covering the direct methods today. We should also be able to assess the convergence and accommodative amplitudes, and ideally evaluate sensory status and any potential suppression. So today I'm going to be going through and teaching you how to do the cover test to look at a phoria or atropia, and doing vergence testing using step vergence with prism bars and also the near point of convergence. Also be looking at accommodative amplitude, testing accommodation, and looking at something called the ACA ratio, or the accommodative convergence to accommodation ratio. Be also looking at sensory status and suppression and testing this with a stereo vision test. Again, I can't stress this enough, must always start out with an accurate and up-to-date refraction.